I know that we might be a smaller group today, but I hope that this will be a good opportunity for some discussion if you are open to that. Otherwise, you're welcome to also leave comments in the chat. When I'm presenting, I love seeing emoji reactions as well. And also just a note that this is being recorded, so wanting to offer a welcome to those of you who are watching the recording of this presentation. So I want to offer my thanks to Casey for getting this organized. My name is Vic Welly. My pronouns are they, them. And this session is called Working in Crisis and Emergency Settings, Staying Grounded in Peer Support Values. So for the next hour, we're going to explore the following. This is the overview here. We'll do some introductions and group agreements. And then we will talk a little bit about what do we mean by this word crisis, and offer a couple of definitions and think about that a little bit more. And then we'll be reflecting on our own lived experiences of crisis and how that informs our peer support work. And then we're going to spend some time looking at the peer support core values and how those might apply for responding to crisis. So those are the things that we'll be covering today, and then we'll go over some of the upcoming trainings since this is part one of a three-part series. So I'm gonna offer a little bit of an introduction of myself, but while I am doing that, I would love to learn a little bit more about you as well and who all is joining us today. So if you feel comfortable in the chat, I would welcome if you would share your name, if you want to share pronouns, how you would like me to refer to you in the third person if I'm not using your name. If you could share where you're located and your peer support role. So again, my name is Vic. As a visual description for accessibility, I am a white genderqueer person with short brown hair that is turning gray. I'm wearing glasses with dark frames, and I'm wearing a blue button-up shirt. And my background is blurred, but you can see the faint outlines of a window and a chair in the background that has a quilt over it. And some of the lived and living experiences that I bring to this presentation and to my peer support work include my own experiences with disability as a trauma survivor, as someone who has experienced times and still experiences times of wanting to die by suicide, and someone who has been given a number of psychiatric labels by the psychiatric system. However, those labels are not how I make meaning of myself and my experiences. I rather identify as a psychiatric survivor and someone who makes meaning of my experiences through different lenses, including spiritual meaning making and experiences with trauma. My peer support work, depending on how you define it, I've been doing professional and community-based peer support work for a number of years. So anywhere between 10 years of maybe the professionalized peer support work and I'd say over 20 years of informal peer support work. And some of that has included working in peer-run respites, helping facilitate support groups. And my advocacy work includes a strong belief that abolishing forced and coerced interventions is part of what is important for me in terms of people being able to access real healing spaces. I currently do some trainings, most often with intentional peer support, and I also do my own trainings, such as the one that you're seeing today. Some of my past work has included working in religious studies. So I bring some of that lens to the work that I do of how people make meaning of their experiences, including through spirituality. And I'm also an activist, and so I bring some of my experiences in activism to this work. And finally, I think it's important to note that when we talk about our lived and living experiences, we're not just talking about the traumatic things that have happened to us, but we also talk about what we've experienced in terms of healing. And for me, that lived experience also includes healing and community. And so I wanted to highlight that as well. So I want to pause right now so that I can take a look at the introductions you all have offered in the chat. So I'm seeing some experience with soteria. I'm seeing some experiences throughout New York State. I appreciate folks naming the work that they're doing supporting loved ones as well, that there is support that is offered in our families and our communities as well, not just in the professional roles that we have. Seeing in different varieties of nonprofits and places where folks are doing peer support work. All right, thanks for those of you who have shared about yourselves in the chat. I am excited to hear more about some of the experiences and your perspectives based on your own life experience and the work that you do. All right, next on the slide, group agreements. This is what I hope we can use for how we hold the space together. So first of all, take space and make space in terms of participation. So I will invite some discussion and participation through the chat and through conversation. We're a small enough group that I don't think we'll do breakouts today. So when we do have that discussion, just pay attention to how often you're speaking in relation to how often you're making space for others. I also talk a lot about brave space versus safe space, that we all have different definitions of what a safe space is, and that we can't always guarantee a safe space, but we can make it a brave and safer space. So recognizing that we might be talking about difficult topics, and we trust that we are well resourced to take care of ourselves, to support one another, and ask for what we need. We are going to try to practice speaking from personal experience and also remembering that a single person doesn't speak for an entire community or an entire lived experience. Again, because we are peer support workers, embracing that concept of nothing about us without us, we'll practice not sharing details of another person's story. So for example, if we have a family member, can we practice saying, when a family member was in crisis, I responded by doing this, and then talking more about what did you do instead of giving all of the details that would personally identify a family member or someone that you've worked with in the past. And finally, practice holding multiple perspectives and being mindful of how we impact one another. So we might not all agree on our different approaches, and I'm excited to see how we can hold those different perspectives together. So if I could get just an emoji reaction of how is this sounding for you? So if I could see maybe a thumbs up or some positive reaction if you are good with these group agreements, or something in the chat if you want to say, yeah, these sound good to me. Right, I'm seeing a heart, I'm seeing a thumbs up. All right, thanks. And finally, I want to ask that you also please hold me accountable for holding these group agreements as well. So if you need to call me in about any part that I'm presenting that isn't landing in alignment with these group agreements, please let me know. All right, let's get started. So what do we mean by crisis? Now, these are not the only definitions, but I wanted to get us started with some shared language for today and for the future sessions. So I wanted to offer a couple of different possibilities for how we talk about crisis. And I'm wondering if someone would be willing to come off mute and read that first bullet point.
I'll read it,
Go ahead.
and I actually really like it. An obstacle that is, for a time, insurmountable for an individual or group by their usual means of problem solving or coping. From carebasedsafety.org.
Thanks.
I
Yes,
love that.
yeah, I'm interested. Would you be willing to say more about what you love about it?
For a time, because it kind of highlights that getting past it is possible,
Mm-hmm.
so it kind of keeps that mindset as I can do this, as
Mm-hmm.
opposed like to the defeated. Yeah, I really like that a lot. I'm gonna be using that from now on.
Yeah, I love it too. Yeah, Care-Based Safety is an organization in Michigan that's doing community-based crisis response. And
Yeah, thanks for sharing.
um, I really, yeah, resonated with this as well.
Yeah.
I want to throw that out to others. Are there others who are noticing something in that first definition that resonates with them or something that stands out to them? And you can come off mute or put something in the chat.
I really like that it's contextual as opposed to, like the essence of somebody's experience. Like it's dependent on the setting that they're in. And I think about like the larger, society that we're in doesn't have a
Yeah.
lot of tolerance for certain experiences. But then when I think about like the peer respite where I work, there's like way expanded tolerance for different behaviors and speech and
Hmm.
lots of different things. So the definition of crisis changes whether the person is, in that context or a different context, which I think is really an important aspect of it.
Yeah, absolutely. Yeah, this definition allows for that understanding that we don't define crisis for others. It's about their own experience and what they are experiencing as crisis. And so if their usual means of coping is just not working out, that could lead to that crisis point. Anything else? I'm also seeing some more positive responses in the chat to this definition. Relatable and not romanticized, and really placed in reality and larger and outside of not just mental health, but the health of all people. Well said. Yeah, I'm seeing some positive responses to that comment in the chat. Yeah, another thing that I really appreciate about this definition is that it acknowledges a group. So an individual can be experiencing crisis or a group. And I think, you know, at this current point in time when we are going through some significant upheavals politically in the United States, there are folks who, are part of communities, entire communities that are experiencing some really challenging circumstances that are creating a lot of insurmountable challenges that they are trying to figure out together. How are we going to navigate this? And the second definition that I wanted to offer is based on a dictionary definition, and this comes from the medical world. And it has to do with this concept of a turning point. So it says a turning point for better or worse. And this is referring to someone who, might have some sort of disease or a fever. And this was referring to that turning point where things reach a particular crisis point where it could be the place where they turn around and something shifts, the fever breaks, or it could be a turn for the worse. And so I'm curious if there are any responses to that or how that might apply to how we think about crisis in peer support work. Right. I don't see any comments in the chat and I don't hear anyone coming off mute. So what I'll offer for this is that I think this is another opportunity for some choice and also some meaning making. So how many of us, when we hear the word crisis, we automatically think, oh my gosh, this is bad. This is going to be really awful. And we find ourselves preparing for the worst. And yeah, I'm seeing another comment in the chat coming through that it broadens crisis from being exclusively negative. So what might it be like if we saw crisis as something that we can learn from? And it might be a really difficult learning. But again, folks like Sherry Mead from Intentional Peer Support often talk about crisis as being a possible opportunity for learning something more about ourselves, our community, and going from there, and not necessarily assuming that it's always going to be the worst possible thing, that it might be something that breaks open and leads us in a different direction. So given those definitions and that framing of how we want to talk about crisis, what I want to do right now is offer a pause for you to do some personal reflection of your own. And if you are watching the recording, you are also welcome to pause the recording for as long as you like. But for right now, for this group, we're just going to spend about 5 minutes on these two reflection questions. And so I want to ask you to think about, or if you have something to write with and you want to journal these as well. First question, what have your personal experiences with crisis taught you? And the second question, how do your past experiences with crisis influence how you respond to crisis in your peer support work? So I am going to set a timer and let you know when that 5 minutes is up. And you are welcome to start that reflection right now. All right. Let's take about 1 more minute to finish reflecting on these two reflection questions. And then we'll invite some replies. And if you want to share in the chat, you can start typing replies in the chat. Otherwise, I'll invite you to come off mute and share some of your reflections. All right, so looking at that first question, what have your personal experiences with crisis taught you? In the chat, I see staying calm, being focused on solutions. What else would others like to share?
Typing is hard for me because my MS. It
Go
takes me
ahead.
forever.
Yeah, I'd love to hear.
The 2024 was nothing but crisis. I'm going into 2025. So I think what I've learned as I'm still in the midst of it is resiliency. It has taught me that I have more resiliency than I thought. And it's kind of taught me how to make meaning and be able to focus on positive aspects without being toxically positive to myself.
Mm,
You know what I mean? Like validating the
yeah,
suffering and the pain
yeah,
and making meaning out of it, but not invalidating it, just
yeah,
figuring out
absolutely.
what I've learned from it so that I can maybe figure out how to stay afloat.
Hmm. Absolutely. I'm hearing that tension of holding the realities, the
Oh, yeah.
complexities of it. It's not just good or bad, it's a whole mixture of so many different learnings about yourself.
Yeah, humor is a big one for me. Like I
Yeah,
have dark humor and people are often like, I'm like, no, it's okay.
I hear you on that as well. Yeah, thank you so much for being willing to
Yeah.
share.
Yeah, no, thank you.
In the chat, I had a message shared directly with me, taught me that you can get through it. You're probably stronger than you think. Another comment in the chat taught me that the more I know and the more I learn skill-wise, the better I am to navigate any crisis, while also being real that society and culture are very much against me as a poor, trans, queer person of color displaced by colonization, and that due to my crisis, it may not ever be one-off. In terms of how it influences my peer support work, it's been hard. I find myself sometimes being pushy, but also really calm and like I am able to handle it much better than others and bring I'm not sure if I'm catching that last part about anxiety over crisis lesson. So feel free to come off mute if you feel comfortable. Otherwise, what I'm hearing from that is, yeah, others um, finding that balance of offering that sense of calm, but also recognizing how crisis can bring up that anxiety. And I appreciate the naming of all the broader factors in our lives that might not go away right away. So when we talk about crisis as something that can be temporary, some of the circumstances, those broader cultural and societal issues, might not be going away anytime soon. And so, how do we navigate life when that crisis is ongoing? Or in the case of chronic illness, when there might not be a clear end in sight? And how do we find a way through? And thanks for I'm seeing some clarification in the chat. Yeah, that um, there can be a lot of anxiety over crisis situations, not feeling prepared for them. But sometimes we find that we have just what we need. When we find ourselves in those situations, we will find ways to get through. Seeing another comment about having non-judgmental, loving presence of others and how important that is, how interdependent I really am with others, despite parts of me wanting to be ultra independent. And in my peer work, I try to be that loving presence. Yeah. I'm resonating with so much of what's being shared. Some of the things that I have learned from myself, it's taught me who is trustworthy, who are those people that I can count on, when I take the risk to be vulnerable, or when I can no longer just rely on myself and try to, push through on my own. And I think it's also offered me an opportunity in my peer support work to offer things to others that I wasn't able to get, the kind of deep listening, the presence, holding space for people in ways that I wish that I had sometimes gotten and didn't get during my times of crisis. Thank you all for sharing. I'm seeing more comments coming through, and I want to move us through into the next section. So as we reflect on our own experiences that bring us to this work and inform our peer support practice, we want to also be looking at what are the values that can guide us in trying to figure out how best to respond, because as you all are highlighting, sometimes we need different things, or our crisis situations are different from what others are experiencing. So what can we do to support people in these crisis settings, in situations that we might not know, or that anxiety might come up? What are some values that we can stay grounded in? And so for this, I want to highlight the National Association of Peer Supporters has their national practice guidelines, and they start by outlining peer support core values. So I'm wondering if we can read through those as a group, kind of popcorn style. So anyone who is willing to come off mute and read one or two of them, and maybe we'll get through them all together. So feel free to come off mute and read some of these. I'd like to go first.
You can go first. I'll read a few of them. So peer support is voluntary, peer supporters are hopeful, and peer supporters are open-minded.
Thanks. I'll read the next one. Peer supporters are empathetic.
Peer supporters are respectful. Peer supporters facilitate change.
Peer supporters are honest and direct, and peer support is mutual and reciprocal.
Peer support is equally shared power.
Peer support is strength focused.
Peer support is transparent.
And the last one, peer support is person-driven. And there is a link at the bottom of the slide if you want to read that full document with the national practice guidelines and how that all fits in. And we're going to be continuing to use these core values and the national practice guidelines today and in other parts of this series. So next, I want to look through, and I'll come back to this slide, but I want to pose some questions. So in your peer support work, which of these core values have most helped guide your approach to supporting people in crisis? Do you have examples of practicing these values? And then the second bullet point, which peer support values are harder to practice in crisis situations? So what I'm going to do is put those questions in the chat for you to refer to. And if you're watching the recording of this, you can pause and maybe take a screen grab of these questions so you won't be able to see the chat. And then go back to this previous slide. So let's continue, and I'll pause a minute if folks want to take a minute to reflect, or if someone has some answers right away, we can dive right in. But again, want to give some space for some reflection, because I know sometimes folks process information at different paces. So it's okay if we have a little bit of pause and some silence as folks think through these two questions of, in your peer support work, which of these core values have most helped guide your approach to supporting people in crisis? Think of an example if you have one. And then which values are harder to practice? So I'm already seeing a reply in the chat naming empathy. And I'm wondering if you would feel comfortable coming off mute and saying more about that.
Sure. I feel it's a big one because I'm a family peer advocate, and I remember when my son, who's now 17, had his first hospitalization, and I felt completely alone and secluded. And now that I'm working as a family peer advocate, I'll sit and I'll listen and validate their feelings, because I've gone through it, and it's the change, even after the first conversation, is huge, because I had a few parents say, "Thank you so much. This is the first time I've spoken to somebody that understands." So I really, feel being able to, empathize. Like you want that when you're struggling, you want that empathy as opposed to the sympathy. So I feel like it's really a big it's really a big thing, especially during crisis.
Yeah. Really appreciate you sharing the power of validation and letting folks know that they're not alone in it. That's so powerful. Thank you.
I think it's important to be open-minded because it is family driven. I recently was working with a family that the son was in the hospital and the providers wanted to keep him in the hospital. The mother knew in her heart if she took him out and let him go to a relative, a different environment, he would do better. And it has worked out beautifully. But she had hit so much resistance for that with that. And you have to remember, it's, the mother knows the child best, or the parents know the child best. And you have to take into consideration, what they're feeling, where a lot of providers, just kind of blow the parents off sometimes. I've seen it, I've been there.
Yeah. Yeah, not only blowing off the family members, but also the person who's experiencing the crisis as well.
Yes.
That has very much been the case. And as peer supporters, we can be those advocates to not only be open-minded to maybe more out-of-the-box ways of working through the crisis, but also being there to facilitate that change. We can be those advocates. Thanks for sharing that example.
You-
So I don't do direct peer support work in my role. I'm on the training team and I'm regional coordinator, so it's much more indirect.
Yeah.
So I don't have any personal examples, as work in the field, but I can say that as somebody who has experienced it as a peer through my own hospitalizations and figuring it out, peer support groups, what was the most important for me really was that mutual reciprocity, because feeling that other people really kind of have walked, and nobody's walked someone else's walk specifically, but when you can share elements of pain that are really unique, it's empowering.
Yeah.
And you feel like, yeah, maybe I can do this. So for me, it was really the mutuality and the reciprocity that was helpful to me. But I can say what I know I would have the hard time with is I'm an honest person, but being direct, if I think it might hurt someone's feelings, is something that I would have a really, really hard time with, I'm going to be honest.
Yeah, I so appreciate that honesty and
Yeah.
just naming where your edges are in terms of your
Yeah.
practice. Yeah. Yeah, and I'm also resonating with that mutuality and reciprocity. Honestly, when I reflect on some of my own hospitalizations and my experiences in the psychiatric system, um, some of the only things of value to me was
It's the other people.
the other people there. We didn't call it peer support. We weren't doing it anything formal practice, but we were showing up for
Right.
one another in a really difficult situation. And to
Yeah.
be able to feel like I was useful, that I could offer something to someone when I was at this really low point in my life, really helped transform things for me.
Yeah.
Thanks for sharing your own personal experiences. I think that's really important.
Yeah. Thank you.
And I see a comment in the chat that all the core values mentioned are important for support. Some families will need more support, some less. And the core values importance can be different for different families. To recognize this as you learn from your families will help in how you support them. Yeah. Yeah, again, I think that highlights too that last one that peer support is person driven. So the needs are going to be different, and it's up to the person who's experiencing the crisis to be able to be the kind of the director. I heard the other day someone given the metaphor of a conductor of an orchestra. They're the ones that are kind of controlling the rhythm and the pacing. We're saying, a little bit louder here, or maybe not so many trumpets right here. It's about how are we going to be centering those most directly impacted in the crisis and supporting them through it. What else is coming up for folks? Either things that have been most helpful or some values that are harder to practice in crisis situations. Well, I will share a couple of examples. So I think for me, one thing, just highlighting that first one about peer support being voluntary. So first of all, is the person even really wanting peer support in the moment? Are they wanting to engage with a peer support worker? what kind of support do they hope for? And I know that I've encountered this sometimes when I used to work in a county-based system where services would be kind of directed by a case manager. And I would sometimes meet with someone for the first time. This wasn't a crisis situation, but it had some parallels. And they would just, we'd meet for the first time, and the person would say, "Well, I really don't know who you are, what you're doing. My social worker said I was supposed to meet with you." And that's an example of a peer support that might not be entirely voluntary. And so for me, it was checking in and saying, "Well, here's what I do as a peer support worker. Here's what I can offer. Is this something you think would be useful? And if not, how can I help find the resources that would be most beneficial for you in this situation?" So again, checking in, is there the desire for peer support? Is it truly voluntary? Is there choice involved? And then thinking about peer supporters as being respectful. Any examples of how you can demonstrate that in the moment in your work? Some of the things might be small, but they can make a big difference if someone is in crisis. So, for example, pronouncing a person's name correctly can offer, a really small but concrete validation of who they are as a person. Or if they have disclosed pronouns, and their gender presentation might be different from what you're assuming it was when you first met them. Can you recognize and use their pronouns? Speaking for myself, it makes a big difference if someone is referring to me with they, them pronouns at a time when I'm going through, I mean, any time, but especially at a time when I'm going through some difficulties. To have my identity validated means a great deal and can help build trust and help lessen the sense of distress that a person might be feeling. So that's an example of practicing that respectful element.
Yeah, and and along those lines, because I think this is just especially relevant right now in the world, it's just so relevant and important. If I misgender someone, and I have, because we're human, we all do it. I have found in my experience that it's really important to acknowledge that you did it, not make a big deal about it and make this big spectacle of it, but be respectful enough to say, "Hey, shit, I'm sorry, misgendered you." Really just own it.
Mhm.
And just, let them know that it's important enough to you to own that was something that happened. Do you know what I mean? And if that's something that's not like the right way, like I've asked people to educate me on how you would prefer if that were to happen. I think it's important to know what would make a person feel heard and validated and safe.
Yeah. Thank you so much for offering that example. I appreciate it.
I've done it.
I have too.
I mean, we're human, right? But
Yeah.
it's about being respectful and loving.
Mhm. And I thought I saw a hand up. If you want to go ahead, whoever had a hand up.
I did. Two things. I could definitely relate to the name thing because for me, my full name is very triggering, due to a past experience. So I totally understand the name thing, and I really do try to correct myself if I'm, wrong and acknowledge if I've made a mistake to the best of my ability. But the other thing is sometimes I've accompanied families to like school meetings and stuff like that. And I basically had to, you see like the person running the meeting is just like walking all over them. And it's like they're as much a part of this committee as anybody from the school district. So I really had to like, put it, and it's from the parents that I've done that with, they appreciate it because often they feel steamrolled when it comes to a school issue.
Yeah. Thank you so much for that example. Yeah, the role of being that advocate, standing alongside someone and practicing ways of being respectful. We can be that example for others as well as showing the support for the person who's going through the difficulties. Looking at the time, I want to go through, we've covered most of the core values here, but I want to, let's see, transparent. I'm wondering if someone has an example they could offer about how can peer supporters be transparent in crisis situations. An example I can offer is disclosure and documentation. So, for example, depending on the setting where you're working, confidentiality might look different. And so, if you are speaking with someone, can you be transparent about whether or not the conversation you're having with the person can remain completely confidential? Or if you are feeling pressure by your workplace or policies and procedures to disclose any details of what's shared. And so that can include if a person is disclosing some coping mechanisms that might be considered self-harm, or it could be disclosing aspects of their identity, whether or not they have documentation in terms of their immigration status, what they might be disclosing in terms of their gender or sexual orientation. So, are you practicing transparency in terms of letting them know what you are required to do in your role as a peer support worker, depending on your workplace? So, for example, if you are expected to write notes about any meeting you have, can you do that collaboratively and let them know, hey, I need to write something on this piece of paper. What would feel good for you in terms of disclosure and, being transparent about some of the limits that you might face in terms of that transparency and confidentiality. Any other examples that are coming to mind as we have these discussions, either about how to put these core values into practice or some challenges with putting them into practice? All right, I don't see anything else in the chat. So let's start to wrap up. And again, what I would invite you to do, since this is part one of a three-part series, we're going to be continuing to explore these core values as well as the rest of the national practice guidelines. And so I invite you to continue thinking about these questions, and especially that second bullet point about which peer support values are harder to practice in crisis situations. So if you are available to join us for the next session next month, I'd invite you to come with some of those challenges. Think through what are some of those trickier areas where it's harder to stay true to the peer support role, because that is what we're going to be exploring more deeply in the next session. And I want to pause here too and ask, as we start to close out, what other questions might you want to try to tackle together if you're able to come to either the session that's in February or the session in March about peer support work in crisis situations?
For me personally, I'm thinking about just that line of like, we're not mandated reporters as peer support specialists, but when we're in situations and we're listening to somebody who's clearly expressing a desire to maybe end their existence, that tension of panic,
Yeah.
what do you do,
Mhm.
authentically when you really genuinely you want to step in and do something, but it's really not necessarily our role. I just think I'm grateful I'm not in that situation in my work role because I don't think I would know how to live
Yeah.
right.
Yeah. That is a tricky one.
Yeah.
It is a tough one that brings up some real ethical concerns.
Mm-hmm.
And I'm seeing in the chat, yeah, there is some differences depending on your workplace and depending on
Gotcha.
how you define that term mandated reporter. There's not a lot of there's sometimes some confusion about what do we
Oh,
actually mean by that and what should, yeah. So
thank you, Bianca.
let, we might be, yeah, we might be needing to unpack that a little bit more. So thanks for
Gary. Yeah.
putting a pin in that, making a note of that. So something we
Love
can
it.
be thinking
I'll
about.
be here next time. I love you.
Thank you.
And so, yes, this is part of a series. So, part two, if you are able to join us, is going to be Tuesday, February 25th. And part three, I'm excited that Bianca Martinez is going to be joining me for that conversation where we kind of talk about how do we advocate as peer support workers and what does that look like? So we might get into some of those trickier areas. What do you do when you're feeling those pressures of my supervisor who's in a clinical role is telling me I should do this, but I know the peer support ethical values say I should do this. How do I navigate that? And how do I center the person who's in crisis and what they're asking for? So, a lot of different things to think about. I'm gonna stop sharing my screen right now and just say thank you all for spending time here today. I know there is a lot going on in all of our workplaces and our lives, in our broader culture. So I thank you for making the time today. And I'd invite, if you're able and willing, if you want to just put a note in the chat and reflect, how are you feeling at the end of this session? We've just gone through talking about crisis, reflecting on some of our own experiences with that. How are you feeling? Is there a word or a phrase that's coming to mind at the end of this session? I'm seeing some thank yous, feeling supported, grateful for the conversation, wishing we had more of them like this, feeling connected and grounded, looking forward to the next one. Appreciating this framework around crisis. All right. I am really grateful for the conversation. I'm grateful to those of you who are willing to share about your own experiences. And I look forward to seeing some of you next month. And please feel free to invite others, and we'll continue this conversation. Take care.
Thank you.